Hello. So as of today, it's 3 weeks since I've had the bone-anchored hearing aid post put onto my head. As many of you know, as I've stated before, I have a hearing loss, and I'm getting the bone-anchored hearing aid, which will help me hear 70% better. That's a pretty huge difference considering now where I have, I have about a 50% hearing loss in my left ear and only about a 30% hearing loss in my right, which isn't bad, but isn't that great. Especially with me, I'm not able to hear low voices. That's one reason why I got this done. With my middle ear not being the best, that's actually where it's mostly causing problems. I'm not able to hear low voices. It's a little challenging. It sounds like everybody is muffling. I'm not able to hear whispering or soft voices. I can't be in a crowd where I can understand one conversation. I hear about 10 other conversations. So imagine having 3 kids in your house and hearing all the kids yelling and screaming and your husband's trying to talk to you and the kids just keep on screaming and being kids. Well, back in January I went to the doctor, Dr. Haynes, who was an awesome doctor. He did my first surgeries where I was able to get my hearing corrected, where I didn't have to wear hearing aids. And he told me that I needed, if I wanted to correct it, I could get either hearing aid or the bone-anchored hearing aid, which also known as a bone-anchored cochlear. And I did that, even though I knew that was going to require surgery. Me and Bradley researched it and looked at all the pros and cons. There's more pros, thank goodness, than cons. We were nervous about it at first because I'm thinking I didn't want to have a screw put in my head. But after really listening to the doctor, and then having the tester, I guess the sample, what they do is put it on a headband and it's actually able to hit on your head a little bit. And then you can kind of see my hearing went up about 70%, which is awesome. So then we went to a follow-up appointment in February, seeing, what all I wanted to do, and definitely wanted to do the bone-anchored hearing aid. We prayed on it, of course. Thankfully, the Lord was able to help us. It's something that I was prepared for. We either were going to have to do surgery. Went to surgery about 3 weeks ago, April 29th, in the morning. I hate needles, but part of surgeries, and I hate surgery, but if this helps me be able to hear 70%, I'm all for it. I'm all for the surgery. How did they put a screw in my head, you ask? Well, they go about right here. I don't know if I'll be able to get it good or not. If you can see it, where my fingers are. It pretty much went there. There's a little bitty screw. It's honestly the size of your tip. Processor is about maybe that big. What they do is first they give you this cap. Processor, but the back of it that fits onto your head will be like that. So then you simply just go in there. It's hard doing this with one hand. Snap it in there. And then it's in there. I apologize if that wasn't a good shot. Well, it's hard to do that when you go in the back of your head. And then it just snaps back off. I learned last week we went to a checkup. We thought that we were going to get it sooner because a lot of your newer doctors, a lot of your doctors with this have learned that they can go ahead and do it within 6 weeks. But our doctor, Dr. Bennett, we actually went to him because he's actually Dr. Haynes' partner. And we didn't get to use Dr. Haynes, unfortunately, because he was backed up. But Dr. Bennett is just as good as Dr. Haynes. And he said, unfortunately, he's a bit old school. He wants to wait 3 months. Because, just for the bone to heal, he wants everything to be healed. He wants everything to be good, which, yeah, I was bummed. I was sad at first. But I'm like, well, I'd rather have a doctor that I know is going to make sure that I'm safe, that the bone is healed, my skull is healed. The screw is attached very tightly. Because if they were to go on and do it now, it's a possibility that the vibrations will cause it to get loose because it's not 100% healed. I mean, it's pretty much, it's about, I'd say about 85. I can actually move around better now. Back a couple of weeks ago, or when it was hard for me to move, I got lightheaded easy. I'm still somewhat lightheaded. I don't get as lightheaded, thank goodness. The hardest part is just getting used to the fact you have something on the side of your head because of the fact, well, they literally screw on your head and have a little button. I don't have to wear this as much. This is actually the second day I have not had to wear it. Last week I was told I could take it off, so I took it off. It's kind of weird looking. They had to cut some of my hair. That's why I also cut my hair, because when my hair was like past my shoulders, that was going to be a mess, so I decided to go ahead and cut it. But I thought I'd do a follow-up. Thought I'd just do a follow-up and just see how, let y'all know how everything is and pretty much what some of the procedure goes. Sorry if it's not that in-depth video. I wish I could have given you more information. If you have any questions, just ask. I will do a video once I get the processor in August. And I hope you all have a good day and enjoy the summer.